Welcome to the FL Community Podcast, created for the community by the community, where we discuss living with follicular lymphoma with a particular focus on thriving beyond diagnosis both physically and mentally. The following podcast is for informational purposes only and is not a substitute for medical advice. Please speak with your doctor before making any health decisions.
Hi everyone, welcome back to the FL Community Podcast. I'm Dr. Paul. I'm here with my co-host Nikki and with Nicola, our producer. And in today's episode, we're diving into a topic that affects just about everyone diagnosed with follicular lymphoma at some point, which is managing treatment side effects. So whether you're on watch and wait, or you're starting your first treatment, or you're navigating long-term maintenance, side effects can really impact your quality of life. So today, we're going to break down some of the most common treatments and the typical side effects that come with them. And importantly, we'll be sharing some strategies and some tips to help you cope, including a few nutrition, lifestyle, and mental health suggestions along the way. So first of all, I'm going to hand over to Nikki, who will give us some of the common FL treatments out there.
Yes, thank you, Paul.
Sure.
So apart from watch and wait, which technically isn't a treatment, but it is, I guess, a strategy, the most common FL treatments, particularly first-line treatments, will often involve rituximab, which is a monoclonal antibody or immunotherapy. So the chemotherapy-based ones are R-CHOP, BNR and RCVP. So those are the most common ones. We're going to probably deep dive into rituximab, CHOP and bendamustine, as well as there are some targeted novel therapies that have come out in recent years, particularly CAR-T, bispecific antibodies, PI3K inhibitors. So we'll touch on those, some of the most common side effects for those. And then there's also maintenance therapy, so ongoing rituximab. So there's some we'll touch on some ideas on how to deal with some of those side effects nutritionally and on the mental health side of things as well with Dr. Paul. So what should we get started with rituximab, shall we?
Sounds good. Let's dive in.
Yes, great. So we can start off with some of the common side effects with rituximab. I don't know about you, Paul. I know I had an initial reaction with the first infusion, which is really, really common. And I think it's important to talk about that, about whether I know with my first infusion, I got a really itchy, scratchy throat and I felt like I had an instant cold come on. And so they had to give me some antihistamine. It was quite scary in the beginning, and I want people to know that these initial reactions are quite common, but doesn't happen with everyone. Paul, did you get an initial reaction with rituximab?
I did, yeah, same as you really, Nikki. I had that feeling of like getting a cold, it felt like an allergic reaction. I think my heartbeat slowed down a little bit. I felt a little feverish, but they just slowed down the drip, and I recovered, and then it was fine from then on, actually.
Yeah, that's good. Yeah, so same with me. They slowed it right down. They tend to do that with the first infusion, and they gave me some Benadryl or antihistamine, and they just gave that to me every time, and that was fine. I carried on. But some of the other common side effects with rituximab is fatigue, low immunoglobulins. So your antibodies are even 11 years after having rituximab, my immunoglobulins are still low and out of range. I know particularly I suffered quite a lot with mouth ulcers, and I had a really weird actually side effect from rituximab. I got something called geographic tongue, and that was where all the taste buds on my tongue all moved to the sides of my tongue. So my tongue was actually smooth, and I couldn't taste anything for about 12 months.
That sounds awful.
Yeah, it's quite interesting. I got a photo of my tongue back then because you could see how smooth it was. So that was, it wasn't fun, but it was quite a different one. So so I'd love to hear from anyone else who also got geographic tongue. Make sure you pop a comment into the Living with Follicular Lymphoma community. But yeah, so the other one I've got here is gut microbiome disruption. So it can cause a lot of issues with the gut microbiome. And I know, Paul, you've been having some issues there since you've finished your treatment, haven't you?
Yeah, I've got a blood test coming up in the next few days, and I know that my bloods, my white blood cells, my immunoglobulins, immunoglobulins,
Immunoglobulin. Yeah, it's a mouthful.
the goblins in my blood.
Those little
Whatever.
goblins.
Try saying hypogammaglobulinemia.
No thanks. Yeah, I mean, my bloods are bouncing back slowly, which is great each month post chemo. But yeah, I need to keep an eye on those things because it's clearly impacted me. But yeah, we can come back to that in a bit when we talk about bendamustine, because obviously it was a combined treatment for me, so it's hard to know exactly which was affecting me.
So with rituximab, I think it's really important to point out the effect it has on our immune systems. So immune support in particular is really, really important, and even particularly if you're on rituximab maintenance. So just a few nutritional tips around that. I would be focusing on zinc-rich foods, so lots of nuts and seeds, things like that. Vitamin C, foods high in vitamin C, such as kiwi fruit. And then one really important thing with any cancer patient, FL patients, particularly going through treatment, is get your vitamin D checked. It's really important that your vitamin D is at an optimum level for so many reasons, and particularly boosting your immune system, but it also helps to support your gut lining. Because as I mentioned before, there's gut microbiome disruption, particularly with rituximab. So supporting that gut lining is really, really important. So I would encourage everybody to go and get your vitamin D levels checked out and make sure that they're at their optimum levels.
With the vitamin D, is that does it matter if it's from food or from supplement? What's the best?
It's really hard to get vitamin D from foods. There's a very tiny amount of vitamin D in mushrooms. Some other foods I can't think of off the top of my head, but yeah, so it is best place to get vitamin D is sunlight. From the sun.
Yeah,
but we need a bit more than that, particularly if you're living like in the UK. There's not much sun around, and for me at the moment in Australia it's winter. There's not much sun around, so I do encourage supplementation of vitamin D, but always get your vitamin D levels checked first.
Yeah, so I did that after your advice on that, Nikki, and I think living in Spain, I moved here partly because of the climate and the levels of vitamin D are going to be higher, but I got it checked a couple of months before starting chemo, and it was already quite good. But then I supplemented and I got it higher before starting chemo, which I really credit with the success of my regimen, really. So yeah, thank you for that, Nikki.
Yeah. When it comes to numbers, a doctor will tell you that over 50 or over 80 is fine. I would be aiming for over 100 if we can. So yeah, anything between 100 and 150 is a really good level. So that's really important to keep your immune system as strong as possible. And then hydration, so important, particularly going through treatment. So, and particularly on those infusion days, you want to, as leading up to it, you want to make sure that you're properly hydrated, and not just so they can get a needle into your arm, because I know that's one important reason, is that you've got nice plumpy veins for them to put those put the needles in for the infusions. So
listening to all this, Nikki, like how much you can do for yourself to prepare your body for it. Like, I'm guessing this all comes from like your own research, like a patient going away and thinking, how can I help myself? Because do the doctors tell you all this before? Like, Paul, how did you find it going into treatment? Did they prepare you, say like hydrate, get your vitamin D's checked, or was that you asking for that to get them checked?
It's a good question, Nicola. A lot of it was my own research and speaking to people like Nikki. They did say full SPF coverage before I started bendamustine and rituximab, which I mostly listened to. And they did say hydration is super important, but they never usually talk about vitamins and nutrition.
Yeah.
I mean, they say eat well and a balanced diet, but it's not very specific. So I have to go to other sources. I'm a big follower of the kind of Zoe app, which is a nutrition app, which you can, they're really great. And they measure your blood and your kind of responses to different foods, but also Robert at Lymphoma Survival, has a great,
yes,
a lot
Robert
of us
Miller.
follow him, Robert Miller, exactly. And I don't think, he's not a nutritionist, but he's someone who's lived with
No,
FL for
but
many, many years.
he's well over 30 years, and I
Right.
hope we can get him on the show one day as well, because he's got an absolute wealth of information for FL patients, and I
Right.
encourage everybody to go and join his website if you can. He's got a
Yeah.
lot of really good information.
Exactly. And I followed his kind of plan pretty much to a T in terms of vitamin D, omega-3, various different vitamins, and plan to get your body primed for treatment. So to answer your question, Nicola, it was very much mostly off my own back and my own
Off your own
research,
back, yeah.
which is great if you're someone like me who's super kind of motivated and I said before, type A, you kind of want to be in control. But if you're
Yeah.
not like that, and not everybody is, you're kind of at the mercy of your doctor a little bit. So which is why we need people like you, Nikki, to be offering your expertise, your advice on just how important nutrition is in the management of side effects and overall efficacy, really, of chemo.
Yeah.
Yeah, absolutely. And it is hard because there is a lot of people out there that don't want to, they don't want to get onto social media or the internet or hear what's going on and want to focus solely on their doctor. It's your journey, it's your decision, it's your body, and it's your life. So
Yeah.
Indeed.
yeah. So should we move on to the next one, which is CHOP? Yeah. So CHOP stands for cyclophosphamide, doxorubicin, and vincristine and prednisone, which is the steroid. You were talking about vincristine before, weren't you, Paul?
Yeah, that's if I'm not mistaken, which is the H in CHOP. The vincristine is the part that potentially impacts your heart in some patients, even if you've got no heart issues. And my UK doctor recommended that I didn't do our CHOP, even though I was being recommended to do that in Spain. And that's the reason I chose not to do it. Because he didn't want me having, and this is why you've got a good doctor, if he's looking at your life 20 years down the road and doesn't want you to have heart problems out of nowhere, it's really important. So that was obviously sometimes we have to have it, but our CHOP, but if I didn't need it,
exactly, weigh up the risk versus the benefits. And as I mentioned before, when I was having my infusion, they said that to me, that this could cause another cancer, but maybe not, but in 20 years time, which sort of sits with you. But at the time you're weighing up the risks and the benefits, and
The here and
for me, I
now.
was only 32. Yeah. So when you're really young, you've got to consider that, 20 years, I'll be 52. And, so, and it's a personal decision.
So what are some of the common side effects of R-CHOP then, Nikki? I'm less clear about this one.
Yeah, so the most common side effect is nausea and vomiting. There's constipation or diarrhea. You could have both or go, either way. Weight gain, which is to do with the steroids, maybe. And then there's also muscle wasting, which is really important to look at with any treatment. It's called cachexia. And I know I experienced a lot of that in my treatment. I lost a lot of muscle and a lot of weight. So that's why it's really important to keep up exercise resistance training, building muscle, eating protein. And another thing to watch out for with CHOP is high blood sugar, and that's from the steroid, from the prednisone. So that can happen. So keep an eye on your sugar levels, and also immune suppression. So again, we need to make sure we're boosting our immune system as much as we can. So how can we help ourselves nutritionally? So with the nausea, you can focus on having small, frequent meals rather than having big meals. High protein snacks, particularly for muscle preservation, so to try and reduce muscle wastage. And that can also help with some nausea as well, just sort of little bits of protein throughout the day. Some examples like boiled eggs, nuts, yogurt. And then you also want to sort of like limit those processed sugars, those simple sugars, and also the high GI foods. So GI stands for glycemic index, and it's basically a measure of how quickly that glucose or sugar hits your bloodstream. So high GI meals, they're going to hit your bloodstream a lot quicker than low GI foods. So they've got more fiber and it sort of slows down. So you want to focus on those low GI foods rather than the high GI foods. And then also if you're suffering a lot of diarrhea, you don't want too much fiber in that time. So, and I know that sounds strange to some people. If people have got, well, some of my clients have got, really bad diarrhea, I'll say stick to those white foods, white rice, white toast, cooked vegetables, nice and soft. And the reason why we don't want too much fiber when we've got diarrhea is because the fiber will increase motility of your GI system. It'll just go faster, and you want to try and slow it right down. So we want to go really slow on the fiber, and then when things start to get more solid, then you want to increase the fiber, particularly soluble fiber. So even just some psyllium husk in some water, give it a little mix. So that can be really helpful. Also, like oats, if you can tolerate oats, that's also a really good thing. And actually, an interesting thing, I used to love oats. I love oats. I do love them. But after my treatment, my gut can no longer tolerate oats. I can tolerate gluten very well. I have no reaction to gluten, but it's now when I have oats, my gut doesn't like it. And it's a protein in oats called avenin, and a lot of people with celiac disease can often have the same intolerance to oats with that particular protein. So that's something to look out for. It can change your gut microbiome. Things change. You might be able to tolerate things afterwards that you couldn't, or vice versa. So that's something to look out for. When you've got constipation, you can have ground flax seeds. Mix some ground flax seeds in some water, or with some oats or whatever. So that's a good way to help relieve some constipation, and also hydration. Make sure you've got a lot of water coming through, a lot of fluid going through your body. And then also focus on your gut microbiome after treatment. That's really important. I don't recommend probiotics during treatment just because of the high risk of infection. But you can have those like fermented foods, yogurt, things like that during treatment. But I would suggest stay away from probiotics until your immune system's a little bit higher and you're not neutropenic, which means low white blood cells.
Just on that, Nikki, sorry to cut you off mid-flow. I asked ChatGPT this while I was in treatment, and you can probably correct it. But it told me, I asked you actually previously, and you told me not to take the probiotics yet, which I think was, very sound advice, because I didn't know the risks. I thought it would be great for my microbiome. Turns out not. But I was told to stay away as well from unpasteurized things, including unpasteurized kefir or kombucha, which I love. What's your kind of opinion on that?
Yeah, so the reason to stay away from them is because of your immune system is so low, and it can put you at risk of that infection. So I would stick to like yogurts, maybe not homemade kombucha.
Right.
Sort of more, so not, that will probably more high risk. So yeah, it's the high risk of infection because your immune system is so low that you've got to watch out for. So yeah, stick to safe foods if you can. So particularly, here we go with bendamustine. So in bendamustine, they say particularly focus on food safety, because bendamustine can make you neutropenic very quickly. And so for that reason, that's why you need to make sure that you've got well-cooked meats, poultry, fish, and eggs. So make sure they're really well cooked. Yeah. Have cooked or canned fruit and veg. And then if you are going to have any fruits that are raw, make sure they're thoroughly washed and peeled. And no leftovers. So if it was made more than 24 hours ago, get rid of it or hand it on to the neighbour. So
I probably didn't do most of those things, unfortunately. I went for sushi. I realized too late. I mean, I do have leftovers a lot, but I make sure it's fully heated. I make sure my eggs are fully cooked, fish and things like that. But yeah, I realized a bit late that I wasn't necessarily following the recommendations there, and I think I got lucky. But yeah,
you are, and that's the thing. Like, taking probiotics during treatment would probably be very beneficial for your gut, but it's the risk. So you weighing up the risk and the benefits. So it's too risky. So you wait till you finish treatment. Your immune system's, that's when you start working on your immune system, which you are, and you're doing a great job. And then you start seeing those numbers come up. It's hard though, because you're looking at your white cells, but you're also looking at your immunoglobulins, and the rituximab is going to, well, most typically, I know for myself, I've got hypogammaglobulinemia, which is from the rituximab, and I've still got it 11 years later. And I've tried so many different protocols to try and boost my antibodies, and not one of them has worked. But in saying that, I qualify for the IVIG infusions, but my doctor has agreed for me not to have it because he's looking at me as a patient, not the numbers on my blood tests, because I don't get as sick as what you would normally expect, because I keep my immune system as strong as I possibly can. I work on my gut health a lot, and so looking at me, I'm not getting as sick as you would expect me to.
Okay.
Yeah.
So if we move on to a bit more onto bendamustine and rituximab, which is the area that I have a bit of experience now. I finished treatment in May. It's not as full on as some of the treatments compared to R-CHOP, for example, that you mentioned before, but it really does take a hit to your immune system. And for me, I was hit quite severely with nausea. And some fatigue. With the fatigue, it was manageable. I needed maybe 1 or 2 days, like 7 days after treatment, to just decompress and do nothing. But generally, and the evidence is supporting this, as much as you can, obviously take the rest when you need it, but as much as you can exercise and keep moving during treatment, there's a lot of evidence that's pointing to favorable outcomes and basically priming your body. I don't know if you agree with this, Nikki, that it's signaling that you're continuing and, trying to get back to a base level. And I found it really helped. And this is part of Robert Miller's protocol as well, I would run back from the hospital after my chemo. I wouldn't recommend that to everybody, but I've been into my fitness for many years. And I was running quite a lot, and I would run slowly, but I'd run back from the hospital, and then I would get into a hot bath, which would, is it hypothermia or one of the themias, hydrothermia?
Hypothermia. Hypo is low, hyper is up.
Thank you. That one. And I would do that for half an hour, really hot bath, and who knows if it worked, but apparently that is something that you can do to kind of push it further around your body, the exercise, the heat. So yeah, I followed that protocol. It was very helpful.
Yeah. And if you don't like running, a brisk walk is perfectly fine.
Right. You don't have to be crazy like me to run back from the hospital.
But I suppose it helped you, like your mental health, like you were doing something, you were trying to get a bit of control over something you didn't have, you had to have the treatment.
Exactly.
So it's just getting that balance, isn't it? And
I felt so strong running back. I just had this stuff in my body, but I was running back thinking, I'm amazing. I'm running back from the hospital after chemo, and then my body would react to it a few days later, and then I'd need to rest, and then I'd come back and I'd be okay. And it'd get harder each round, as it does. But I did try to keep that positive attitude. It was tough. The nausea was the hardest part for me, actually, because I love food, I love eating healthily, and I really did not like the things I usually like. I lost the taste for coffee. It just tasted terrible. Avocado tasted terrible. And I don't know what you think about this, Nikki, but for a couple of days each cycle, I just craved salt, and I'd have like veggie hot dogs. I'd have like crisps, and then I'd go back to my good diet again, because I was just getting something in my body that I was craving. Is that
and that's exactly what you should be doing. You need to honor your body's, if you're hungry, honor your body's feelings. And if, and when you're in that situation, just eat whatever you feel, is going to help you. But I do want to bring up the taste change, because that tends to come up a lot, particularly with my clients. There's a few strategies that we have around there, because I think chemo can give you a really metallic taste, and it's awful. You don't feel like eating anything. And so just a couple of tips there. Adding like lemon, like to your water, can help sort of counteract the taste changes. But one little special secret weapon that I found to be really, really helpful. Have you guys heard of magic fruit?
No.
I have now, Nikki, since you mentioned it. When I bought them, and they were very helpful.
You bought them, did you?
I did.
I told you to buy. Yeah. So
yes.
it's a fruit. you can actually buy them dried,
Pastel.
or they call them miracle fruit or miracle berries. And you just buy them online, even dried, and you put one on your tongue, and then for the next, say, 20 minutes or however long, everything you put in your mouth tastes sweet, doesn't matter what it is. What was your experience with them, Paul?
It was great. I did not think it would work because it sounds like magic. It sounds dodgy. But yeah, it strange taste, not unpleasant. And then my usual meals would just taste like a dessert for about 20 minutes, half an hour afterwards.
Yeah.
And I could get the food in me that I wasn't able to eat previously. So they are really great. I'd recommend them.
Yeah, that's really good. I love that.
Mm.
Yeah. So, and then also, if you are not, losing your appetite and not eating, when you do eat, just try and have some really high calorie snacks, nutrient dense, like yogurt and granola, or avocado toast and eggs, or just something that's really nutritious, high dense nutrients. Just to make sure your body's getting all those nutrients that you need. It's so important. Smoothies are great too, because sometimes, especially when you're nauseous, the last thing you want to do is chew and eat something. It takes a lot of work, but sometimes the smoothies can help settle your stomach, sort of line your stomach a little bit.
Oh, Sea-Bands. You recommended that for me, and that really helped as well. Do you want to tell our listeners what that is? Because I had no idea before you told me.
Oh, didn't you?
No.
We get them a lot in Australia because we do a lot of boating here in Australia. Where I live in Mandarin. We're a waterside town, so we do a lot of boating. So if you've ever been on a cruise, those bands that you put on your wrist with the little sort of, it's got like a pressure point thing, isn't it?
Quite a little stone kind of sewed into it.
Yeah, and so you found that helpful for the nausea?
I did. It took me a while to find the right placement, but you need to put it in it tells you on the packet, but a certain point on your wrist. And I slept with it basically, and I would wake up not feeling as nauseous as I would prior. And again, it felt like it is magic. It wouldn't work, but it did. Yeah, it really helped. So that combined with the miracle berries, and I messed around with my medication a little bit under the guidance of my doctor, just to try and find the right combination, because it wasn't quite right. I think I was on ondansetron as the main medication, and what was the other one? Primperan, which is like a liquid, and then they added a low dose of dexamethasone as well, which helped much better, but then the crash was worse afterwards. So that's when these kind of things that you're recommending, Nikki, really helped coming back out of that crash that the steroids helped me with. But yeah, the nausea was the killer for me, because I love food so much, and it just zaps your energy and your motivation. So I'd really have to push myself to get out and go for a walk, sometimes a run, or just huddle up on the sofa in a blanket and watch a good movie for a day, and tomorrow I can get back out there again.
Is there any foods now that you can't face after having the treatment? Like, does it remind you, or is there anything you've just tastes have changed?
It's a good question. Coffee's not fully returned to the enjoyment that I had. It's still a bit metallic, as you were saying, Nikki, which is really annoying. And yeah, the veggie hot dogs that I was having, stuffing down my face, I can't eat them now because I had too many, which is, it's processed. Fine, I don't need it.
I remember giving you some advice when the nausea was really bad about preloading yourself with ginger beforehand. Now, that didn't quite work with you, did it? Because some things work with some people, some don't. But one thing that can work with some people is leading up to your treatment infusion, maybe three days before, start loading up on the ginger and have as much ginger as you possibly can. And that should normally help with reducing the nausea after treatment. But how did you go with that?
Yeah, I followed it to the letter because I eat ginger quite a lot. I love it. I thought, this is great. This is going to work. It's easy. And it didn't work for me, which is really sad. But I'm sure it does work for others, as you say.
It might work.
Just shows we're all individual and,
Absolutely. And that's really important to point out, where everybody's body is different. Everyone's going to react differently to different things. People will get completely different side effects, for the same drugs. So, so that's really important to note.
So one other thing I noticed was obviously you can sometimes lose weight with prior to treatment or even during treatment. And the nutritionist that I had as part of my treatment here in Spain would come in every other treatment and measure all my, I don't know, with some electrical machine that should kind of measure my
like BIA machine. Yeah. Check
something like
your,
that.
your body fat percentage and your muscle percentage.
Yeah, I think so. It was like electrical things she had attached to,
Impulses. Yeah.
right. And she
Oh,
was
I get
always
stuff. Mm.
okay. And she was always very impressed that I was maintaining it. I said, I'm still going to the gym, I'm still exercising, and I was eating a lot more protein than I have done. And I've always tried to eat a lot of protein for the gym, but I realized I was probably a bit needing more. So particularly Greek yogurt, I would have a lot more in the morning, less oats than I would usually have, a bit less oats. I would have a protein shake, but not whey protein, because I've heard that that's not great for cancer because an unbound amino acid or something. Just pure pea protein, which maybe not as tasty, but it's a whole food and it's not, there's not much been done to it, which apparently is better.
Yeah. But complete protein foods like quinoa.
Mm-hmm.
Quinoa has all the essential amino acids in it. That's a really great protein.
Like lentils with rice mixed together is a good way of getting the complete aminos, I think.
Absolutely. Or lentils with quinoa mixed together.
Lentils and quinoa. Mm-hmm.
Yeah, that's really good. So you really want to sort of aim for high amount of protein, but also balance that out throughout the day to help balance your sugars and your hormones as well.
Okay. Yep. So good tips.
Yeah.
So lots of protein.
Yes. And also what I wanted to mention with diarrhea, hydration is really important, but hydration with electrolytes, making sure you're replacing those electrolytes in your body when you're dealing with that is really, really important. And also, particularly with those targeted therapies, like the bispecific antibodies, the PI3Ks inhibitors, to keep an eye on your liver function. So your doctor will do a blood test, generally a liver function test. Keep an eye on those liver enzymes because you might need some additional liver support because they can really cause havoc on your liver. So I think that's really important because I've heard some stories about people having liver failure, based on because we're having lots, as we go through our journey, we're having treatment a lot, and it's those toxic treatments do have a lot of pressure on our liver supporting foods, leafy green veg, beetroot, and also avoiding unnecessary supplements. That's a really big one. As a nutritionist, I'll prescribe supplements, but I'm also really careful of not over prescribing supplements. And the reason being is it can actually release a lot of free radicals around your body, and free radicals are those molecules that steal oxygen off healthy tissue. So a diet really high in antioxidants is ideal for helping to neutralize those free radicals. But if you're taking lots and lots of unnecessary supplements, that can cause a lot of free radical activity in your body and cause a lot of tissue damage.
It's good to know. I used to take loads of supplements, and now I've paired it right back, and then going into treatment again, I added some more. But so I'm currently taking magnesium post-treatment and during, and zinc. I think maybe the zinc might not be needed anymore. I'm not sure.
Zinc is good. Zinc is great, particularly for boosting your immune system. If you're like, if I feel like I've got a cold or flu coming on, I will supplement. I'll give I call it a punch of zinc, like just a high dose of zinc, and then usually that takes care of it, and then I get on with my life and I don't end up getting sick. So that happens quite a lot. I usually combine zinc with vitamin C, so just take a double dose of supplement of that, but it's only very short term. If you keep doing that, that is going to affect your liver.
Right.
So that's why, so just very
not
short
long term.
if you want to, but just not for long term. I found earlier on, before I went to university, I was taking a lot of zinc, and I ended up giving myself a pretty bad nausea from it.
That's really interesting because I take zinc. I had a winter cold last year, and I started on the zinc, and I just carried on with it, that and the vitamin D. So I'm going to look at that. And
it depends on doses. If your dosage is quite low, then it shouldn't be an issue. There is a lot of research out there that continuous zinc supplementation, there's benefits out there. But yeah, keeping a lower dose, but then increasing that dose when you're feeling something come on, it can be helpful there as well.
Okay. And I take a vitamin D, as we've talked about, and a omega-3 just during this period, I think, and during the winter, particularly if you're not in a nice sunny country like I'm lucky to be. But yeah, so it sounds like supplements can be very positive, especially during treatment, but we can overdo it as well sometimes.
Well, the goal of supplements is to replace nutrients that you're not getting through food. So that's the goal. Particularly with omega-3 is really good for reducing inflammation. I think everyone should be on an omega-3 supplement, most people, but that's really, really good to help to reduce inflammation, which is usually step one when you've first diagnosed. Reduce inflammation and then start preparing your gut for treatment. And I also just want to touch on your gut health. So yes, take a good quality probiotic, particularly if you can get one recommended by a practitioner like a dietitian or a nutritionist, because they study the strains and the particular strains for. And you can also do functional testing. You can get your gut tested to see what sort of strains of bacteria are more abundant in your gut and which one are not so abundant, that you can then focus on increasing. And so it's really important to focus on your gut health prior to treatment and then building that up after treatment. But when you take a probiotic, you don't have to keep taking a probiotic. Probiotics are basically seeding your gut microbiome. I think of it as like a garden. So you can take a month's worth of really good quality probiotics and then you stop and then you start fertilizing that garden with prebiotics or fiber to help feed it and grow and nourish it. And that's sort of a key way to help improve your gut microbiome without taking too many unnecessary supplements.
That's really interesting, because a bit like the zinc, I would have just assumed keep taking it is good for you. But particularly post-treatment, I'm almost ready, I think, to start taking probiotics. Again, it's safe, but it'll be a short-term probiotics, but it'll be a short-term treatment, as you say, to seed that in my body, in my microbiome, and then replace it with foods, which sounds really smart.
And don't be afraid to research the probiotic strains in the probiotic that you've got to find out what prebiotic foods this particular strain likes. So you can research that on the internet to find that out and then start increasing that. I remember Robert Miller recommended Akkermansia, which is a strain of probiotic, and I took a course of Akkermansia, and he also said the prebiotic that helps to encourage growth of this particular strain in your gut microbiome was what was it? Powdered apple peel. Powdered red apple peel. So as I was taking it and afterwards, I still now have apple red peel powder in my breakfast. So so don't be afraid to do some of your own research and see, what's good for this particular strain, because it's all part of growing a good, healthy gut microbiome.
Right. And tailored medicine, as it's becoming increasingly, the future, right? Not just
Absolutely.
so generic advice, but really tailor it, which is why I love the Zoe test, because I did a few years ago and it told me my microbiome was really excellent, which was great to hear from all of the fermented foods I was eating. But I imagine if I did it now, it'd be pretty poor because of the treatment I've just had. So I'm really on a rebuilding phase, as you were talking about, Nikki. So I'm really looking forward to getting the probiotics and the prebiotics and eating all the foods finally again.
And also reducing alcohol during treatment, which a lot of people don't feel like alcohol during treatment anyway. But I think that's really important to reduce that. And and focus on managing those side effects like fatigue, nausea, mouth ulcers. Did you get mouth ulcers?
I didn't. I was lucky with that.
I got terrible mouth ulcers. It was awful. I just remember every day I was dealing with mouth ulcers.
Gosh.
But it's where everyone's different and they get different side effects. So
we're talking a lot about nutrition today, which is one of the most important parts, I think, of managing side effects, but also the mental health aspects of these treatments. I guess they're less talked about because the physical symptoms are the obvious ones, right? The nausea, the fatigue, and maybe more important in the short term. But these can cause, I think, knock-on psychological effects, right? And as we mentioned previously, mental health support, whether that's by a therapist or someone else, if that's not possible for you, is vital, because you need to be as primed as possible to enter into this treatment and to finish it. And I hear lots of stories about people saying, I can't do the next treatment, or I really can't do it. It's too hard. And, we need to finish these treatments as much as we can.
Absolutely.
Yeah,
So,
I suppose, how did you feel, Paul, like having that sort of many years of watch and wait, as opposed to like going straight into treatment? Would you have preferred to have gone straight into treatment, or were you glad that you had that period of watch and wait? How did that make you feel?
Yeah, I was really pleased to not have to go straight into treatment, even though I think we mentioned in a previous episode that it was odd. I really wanted to get started and get it out. But as we discussed, watch and wait is a lifeline, because it gives you time to get to know this disease, to understand how it works. And the longer we can go without treatment, the better. It gives us more in the arsenal for down the line. So I'm curious to kind of push it back to you, Nicola, in a way, because you're still on watch and wait, which is great. How does it feel hearing about treatment side effects? I mean, it must be another world for you.
Yeah, I mean, it is. It's. I mean, I've spoke about this on previous ones with being on watch and wait. Sometimes it feels like it will never happen. Like, this is just how things are. This is my new normal. I'm watch and wait, go to the hospital every 4 months, but sometimes I do think about the treatments, if another treatment comes into play, and it does scare me. It's because it is an unknown, isn't it? Like, some people just sail through treatment, other people have horrendous side effects, and they relapse quite quickly and go into another treatment. So I think it's your mind becomes like, treatment's never going to happen because you've had this watch and wait for so long. So yeah, it's really, treatment does scare me. But like you, Paul, I'm so grateful that I've got all the sort of help now. I've got you guys, I've got the group. So I think, had I have gone into treatment straight away, I wouldn't have had half the information I have now. I wouldn't have had that time to look at my life, reduce stress, get a better diet, start exercising. So I think it gives you that sort of just that comfort, isn't it? Knowing, but at the same time, it's scary that it's going to come one day. And
that was the shock for me, because I think I felt very similar to you, Nicola. I was like, I'm just going to keep coasting for 20 years, maybe more. And that day I was at the hospital here for my regular checkup. And he told me I'd lost weight, and we had this scan. I had a scan, and there was a large mass that had grown a lot in the short space of time. And he said, "You're going to need treatment." And I remember standing there with my husband, just broke down outside the hospital. I was like, "Oh God, it's real. I have to face this now."
And it doesn't, sometimes watch and wait, it doesn't feel real, does it?
Right.
It's like, you're just like, treatments are way off. And some people have said at my appointments, I should discuss treatment options with my oncologist, which I don't do, because I just think it fills my mind with things that I don't have to think about at the moment. But at the same time, I do like to keep up to date with what's going on with treatment, new treatments coming in. But yeah, it's interesting to hear that side of it from you, Paul. And I suppose, like you, Nikki, you've had the other side where you went straight into treatment, and
That's
then
right.
you're in Watch and Wait like me now, and
Yeah.
it's
Yeah. And I think it's important to note that even though technically Watch and Wait isn't a treatment,
yeah,
it still has side effects, and they're more sort of mental
Yeah.
health based side effects. So I think that's really important to note as well.
Yeah.
That's what, yeah, that comes in. But yeah, I don't know. I must admit, when the lumps came up, it did worry me, and I had this horrible feeling that I was going to have to go straight into treatment. And
Yeah.
you always think the worst.
Yeah.
And I also had some B symptoms, some night sweats. I lost about 10 kilos in a period of about 3 months. So no fevers or anything though, but yeah, so I was sort of going in to see my oncologist or my hematologist, not knowing what he was going to say. And yeah, so when we left, just my husband and I high-fived each other when we left, because he said to me, no, come back in 6 months, go and do, all the things you want to do, go to Bali. I said, can I have massages in Bali? Yeah, go have all the massages you like. And so we walked out, high-fived, and we're like, yes, I'm on Watch and Wait, I don't need to have treatment. And that was a celebration, because where we're at is, I've been living with this for almost 12 years. We kind of knew what to expect, but you can't help but expect the worst.
Yeah.
Yeah.
So when we heard it wasn't the worst and I could go and Watch and Wait, we were really happy with that. And then I could go on my holiday and focus on my mental health and all those other things. So yeah, I guess it's really different for everybody and where you're at. And I feel very supported. I'm very lucky. I've got you guys, I've got the community, I've got the Follicular Lymphoma Foundation. I know where to get all the resources I need to find the information that I need. So I feel like I'm in a very lucky position to be in. And I think every member of our community is in the same boat. We're all very lucky to be in this community and be supported by each other and the Follicular Lymphoma Foundation.
Yeah, definitely.
One of the things that I'm taking mostly from this session, I think, today is how it's that balance, isn't it, between overthinking and over preparing, but also being prepared, preparing your body nutritionally, physically, emotionally, psychologically for treatment when it will most likely inevitably come. And as you're saying, kind of, Nicola, to not kind of go too quickly into that. You don't need to be asking questions about treatment yet, by the sounds of it, if you don't feel like you need that answer yet. But at the same time, now you're armed with the evidence base, the nutritional evidence base, for example, how to take care of yourself and prime your body for, when you might need to, take that into consideration.
Yeah, that's so important.
Yeah, so I hope the community kind of heeds that advice, and doctors are gods in many ways, but they're infallible gods, and they focus on the medical side of things, which we need them for. But there are other things we can do that are not always so obvious, that they don't tell us about, which can support the medical side of things.
I also do want to bring up, if you are having treatment, there's a few red flags to look out for that I just want to emphasize. So, when those moments where you think, okay, I need to call my doctor. So if you're having high fever or any sort of signs of infection, that's when you need to call your doctor. Any uncontrolled vomiting or diarrhea, call your doctor. Chest pain, breathing difficulties, and particularly any mental health crisis, that's when you need to reach out and ask for help. So I think that's really important to bring up. Those are the red flags.
Really helpful, Nikki. Are there any comments, Nicola, from the community that might be appropriate for our topic this week?
So this is a lady on Watch and Wait. She's recently been diagnosed stage 3, grade 1 to 2, found accidentally. She's got no symptoms, on Watch and Wait. And she's just saying she's been exploring natural and holistic type things to just help her to extend the Watch and Wait time and potentially help with long-term prognosis. She'd love to hear from anyone that's doing things to make themselves feel good and to help with the FL. not in lieu of traditional treatments or medication, but just in addition alongside. She says, I know eventually that will come into play for me with treatment. She's switched mostly to a plant-based, added D3, K2. She's rebounding following YouTube videos. And she's just added various teas, nothing crazy, but hopefully it helps her. And it's just keeping her positive. So yeah, that's good.
I love that message.
I love some of the things she said there. Yeah, like the rebounding, dry brushing. Those things are really good for keeping your lymphs moving. And actually, it was interesting. She says she's on vitamin D3 and K2. Do you guys know why you would go on vitamin D3 and K2?
I have the D3 with that, but I'm not sure what it is. Is it absorption?
Yeah, does it help one absorb the other, or?
So what it actually does, it's particularly really good for people who have high cholesterol. So the K3 activates an enzyme that will allow the free calcium going through your blood to be absorbed into your bones. So it strengthens your bones, and it also reduces calcification of calcium in your arteries. So that's why people will take vitamin D3 and K2 together, because the combination of the two works synergistically to do that. Yeah.
Wow.
So that's cool. Really so that's interesting that she said that, because that's what I would often recommend to clients if their cholesterol's high, and looking for that extra support there.
The rebounding was interesting. I don't know if everyone knows about that who's listening, but that's the little mini trampolines that you can get, which, as you mentioned, Nikki, because I think the lymph system, it's not self-pumping like the blood, so you need to.
It relies on us moving.
Right.
And it's essentially our garbage system in our body. It eliminates toxins. So, but we've got to keep it flowing. Otherwise, it'll just be stagnant. If you lay in bed all day and don't move, you're not going to move any of that through. The rebounding is really, really good. I have my own little rebounder at home. You guys have a rebounder?
No. I had in California, right? There was one laying on the street saying, "Please take me, I'm free." And I took it and I was using it every day. But now I'm running, which I think is
that's
still good. But rebounding is more fun.
Yes, it is. It's fun. But if you've had babies like me, sometimes you've got to watch the incontinence when you're bouncing. So do those
safety of your garden,
ladies. So so that's good. And the dry brushing is really good as well. And it feels good when you dry brush. So make sure you're brushing towards the heart. So brush up the arm, up the legs, down the neck. Everywhere you brush is towards the heart.
Just people who don't know, again, it's like a hard bristle brush, right, that you can buy. But it feels quite
hard,
a little bit painful.
Not too hard.
Okay.
Can be
maybe mine's
soft.
too hard. Okay.
Well, some people will do. There's also lymphatic drainage massage. Have you heard of that?
Never done it.
It's very basic. It's very slow touching. I don't know if you can see. So just basically gentle brushing with your fingertips can help move lymphs. Like I'll often just sort of brush my fingertips down my neck. That'll help encourage flow, because I've got quite a few lumps on my neck.
That's why this FL community is so good, because I think there's so many myths out there I've been told to be careful of massages, but is that like
sports massage?
Yeah,
there's different research.
Like remedial massage.
Yeah,
that's the thing. I'd still do it. I have a remedial massage. My doctor told me I could, but I have definitely heard other doctors have been saying no. So I'm not quite sure if anybody knows, let us know. If you can find any research around it, that would be really interesting.
I'm still nervous to have a massage now, but my physio does give me massages now. But I'm just, even though there's no lymph sites left after remission, I'm still worried about it. So it's gone into my head. So clearly it's, as you were saying, Nicola, it's something, it could be a bit of a urban legend, if you like, or maybe it's super important. It's hard to know with this stuff.
It is. I don't really know why they say no. I mean, when you think about it logically, you know, maybe it could break it up and spread it, but it's
Prod and
there
poke.
anyway. I mean,
Well, exactly.
I don't know. Yeah, like, I mean, I'm stage 4. It's widespread. It's everywhere.
Yeah.
So if we were to do a bit of a recap on treatment side effects and how to manage them, I guess the main treatment side effects we've talked about across treatments really are fatigue, nausea, weight loss, sometimes weight gain,
Mouth sores, taste
mouth
changes.
sores. Yes, yeah. And what are we saying are
What
the
about
best
hair
ways?
loss?
Oh gosh, we've not even covered hair loss. Yeah.
No, yeah, and that's one that, and I guess because I was lucky, I didn't lose my hair. It thinned a little bit, but I didn't. Yeah, and I guess that was one of the first things I thought about when I was diagnosed was I'm going to lose my hair.
Of course.
I love my hair. Look at my beautiful long hair. That's one thing I've always made sure I keep my hair long, because one day I might lose it all, and that's just a vanity thing, you know. I don't mind.
It's a big,
Vanity's important.
part of you. It's like it's
When I got told it was R-Chop initially, I went out and bought like 5 hats in different kinds. I was like, I'm going to be the best hat wearer in any room. And then it changed to BNR, and I didn't lose my hair, although it did thin as well. But it's kind of growing back a bit better now. But yeah, for many people, of course, it's the first thing you think about. It's the most obvious thing that's going to happen to you.
And it's very visual, isn't it? Like someone walked past any of us in the street, you wouldn't think we had an incurable cancer. If you've got no hair, and that's very like every day you're looking in the mirror, aren't you, saying this is cancer kind of thing. So it's a horrible reminder, isn't it?
Yeah.
Men care about hair too. I care about hair, but it's easier for us to cover it up or to, you know, shave it off and it grow back short.
It takes years to grow it long, doesn't it? And I think that's the
yeah. And also with night sweats, when I was starting to get night sweats, I'm a woman in my mid-40s. I put it down to perimenopause, and it's hard for women us of this age, because they put it down to, oh, you've just got perimenopause, and that's normal, and that's why I didn't think too much of the night sweats. So yeah, I think that's, you know, important to point out. Like, don't just put it down. Like, you know, get it checked if you know, if you're worried. You know, listen to your gut. If that's
there are a lot of messages on the Facebook group talking about this, and doctors maybe not necessarily taking particularly women seriously.
Yeah, if you're a
big
particular
subject.
Age, it's just it's the menopause,
which is not good enough. So do push for that second opinion, or
definitely.
We only really touched on fatigue. What did you experience? Quite a bit of fatigue, Paul? What did you do to help with that?
I did. As I say, it was for a couple of days, a few days after treatment, because I was still quite high from the steroids for a few days. Exercise was what helped me. It sounds so counterintuitive, but you know, again, the evidence points to it, right? And it's so hard psychologically. You just feel that you want to be under a blanket, but even just to walk around the block, like, you will feel better, more energized. It's one of the worst parts, because it just zaps energy, but just get out of the house if you can.
Yep, that's it. No, that's what I was going to say. The best way to combat fatigue is to go and exercise. It's, you know, it gets things moving, and, you know, it definitely works, and is really, really important too. There's so many other benefits, and even just exercising, going for a walk is, people don't realize it's really good for your gut microbiome. Just exercise,
getting out,
and also
nature.
boosting your immune system.
Do you know what I would do? I would start every morning with a walk, a run if I could manage it, and then I would go and jump in the sea. I'm very lucky. But especially in the winter when it was cold. I mean, it was a bit of a shock, but for immune system boost.
What is that? Putting your body in ice is good for your immune system. I haven't wrapped my head around that yet, because I don't like cold.
Okay, maybe there's a resistance there, Nikki.
Yes.
I don't know. I mean, I think the science does back it up, but maybe it's just a fad. Who knows? But you get this sense of euphoria afterwards, and you feel pretty good. So even if it's just psychological, I mean, it's, for some people, the cold water swimming is really, really great.
Yeah, we get a lot of them here. Recently, charity, this actually on Saturday morning, the local cancer charity near me, called Dot's Place, whole bunch of cancer patients all got together at the beach and they all jumped in the water and it was about
Oh,
6
wow.
a.m. and there was a storm going at the
Oh,
time.
wow.
It's been stormy all weekend. And I'm looking at the pictures of these women. I'm like, you're mad. I would never do that.
Yeah.
What's good about that? How can that make you happy? I'd be cold and wet and miserable.
Listen, as long as you've got a good dry sheet afterwards and you can get in a hot bath not soon afterwards. We do it all. I know it's easier in Spain, but we do it all year here on a Saturday. And
Wow.
the water is freezing in the winter because it's not far from the Atlantic. But you get such a buzz afterwards.
Do you?
So
Okay.
you do. I'd really recommend it if you've got any,
Okay.
lakes, or I mean, you're next to the sea, Nikki, so you've got no excuse. Just
One day I'll have to try it and I'll let you know how I go.
Okay.
Maybe we'll have a little segment on it.
Yeah, so I was thinking that video evidence.
Leave myself out of this
Yeah.
when I'm in the Midlands, too far from the sea. So yeah,
That's a good excuse.
gives me an excuse.
So yeah, we're going to be diving into, throughout this series, really mental health and nutrition in more depth in different topics. But I think we've covered quite a bit on those topics in this specific one of treatment side effects. Okay, so I think we're about wrapped up for today. What do we need to remind our community about?
Yes, I want to mention and put it out there that coming up in November will be the 10-year anniversary of when I founded the group in November 2015. So it'll be 10 years in November. So I would love to hear some ideas from the community of what we could do to celebrate. Do you have any ideas? Please email us at the flcommunitypodcast@gmail.com or put a comment in the podcast post on the group. Because it's creeping up on us. I want to do something really cool for it. So it's
10
a
years,
little bit
Nikki.
exciting.
Yeah, 10 years. Wow.
10
amazing.
years. Wow. And look where we are 10 years later. So yeah, I'm very proud of that. So I think it would
should
be nice
be.
to celebrate that.
And I believe it's quite a special month for all of us living with FL.
It is indeed. It's the 1st of September, which is Blood Cancer Awareness Month. So the FLF would love to hear your stories. So if you go over to the flf.org, there's a section there where you can submit your story.
Brilliant.
Absolutely. Yes. And it's also a good month to do some fundraising as well for the
Definitely,
FLF.
yes.
And bring us a step closer to finding a cure. So yeah, I'd love to hear fundraising ideas on the group, or, tell us what you're doing to fundraise. I'd love to know.
Great. And please send all of your emails about the 10-year anniversary, about fundraising, any comments you have on this podcast as it's evolving. If you want to be involved, if you want to suggest topics, be a guest. We love our guests. We have one coming up in the next episode. A very special member of our team called Simon. Some of you may know him. So please do send your emails to the flcommunitypodcast@gmail.com. And please do like and subscribe on YouTube and wherever you get your podcasts, on Apple or Spotify. Do boost us. People are finding us slowly, and we're growing our viewership, which is really lovely for us to feel that our work is paying off, and we're doing this for the community. So get involved. Please get in touch with us. Okay, and that's our sign-off motto.
Are we ready? And remember, here at the FL Community Podcast, our motto is
From surviving to thriving.
One story at a time. Thank you so much, everybody. We will see you next time.
Thank you.
Take care for now.
time.
Bye.
Bye.